Boy.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to helping you live better, healthier, and longer. I'm your host, Dr. David Scharf. Thanks for tuning in tonight. Tonight we have a great guest, Dr. Mark Sperber, a dentist in Lindenhurst, New York. Mark, welcome to the show.
Thank you.
And Mark's our local expert on dental implants, and we haven't had a show on dental implants, so I think it's going to be a great one for our listeners. Before we get into it, Mark, maybe just tell us a little bit about where you went to school, how long you've been practicing, that sort of thing.
I went to school at Columbia University, and I graduated in 1980. I've been practicing about 30 years. I have a general dental practice, but we do a tremendous number of dental implants, and they've been a big positive benefit for patients.
I bet you in 30 years of practice, you've seen all sorts of things come and go. You've seen revolutions, really, in dentistry. And I know you were telling me before the show that of all the changes you've seen, that dental implants has probably had the most profound impact on your practice and on your patients' lives. Why is that?
Well, they last longer, they're stronger, they're more functional than any other bridge work that we've ever had. And the beauty about dental implants is they never decay. They don't develop periodontal disease. It's a tremendous value. Patients love them.
Let's back up a little bit for our listeners who don't know anything about dental implants. Maybe just explain what is a dental implant and the whole process.
A dental implant is a small titanium post. It's placed into the jawbone where teeth were missing, and it creates a strong foundation for the artificial tooth that sits on top of it. Mm-hmm. Dental implants can preserve facial bone, which often is lost when teeth are lost. They change the way people live. People regain confidence when they're eating and speaking and laughing.
So let's back up a couple of things you said. First, there's two parts, as you were saying. There's the part that goes into the bone, which is the implant.
Right.
And that sounds like that's the anchor. And then there's stuff that's built on top of that. So how are some ways that anchor is used? Do you need one implant for every tooth to be replaced, or how are they used that way?
Well, you could have one implant for one tooth, mm-hmm. but if you're making a bridge, you could have 2 or 3 teeth sitting on 1 or 2 implants.
What if someone has no teeth in an entire arch? Do they need 32 implants?
No, not at all. They might only need 4 or 5 implants to replace an arch.
So they're so strong that you can replace a whole arch of teeth. An arch has 12 or 14 teeth with 4 or 6 dental implants?
Absolutely. It's life-changing when people get implants because it restores their confidence.
It seems like now implants are almost all you hear about in dentistry. 10 or 20 years ago, almost nobody got implants, but now it seems to be very commonplace.
It is. We have 90-year-old patients getting them. We have 20-year-old patients getting them.
So let's talk about some of those patients, maybe from 20s to 90s. So is there a typical implant patient, or what are the different ways that dental implants are used?
Well, there is no typical patient because today anybody can get them. But implants can be used to replace a single tooth. They can be used to replace multiple missing teeth. They can be used to anchor down dentures that are loose and ill-fitting.
Mm-hmm. Let's get into those one by one. So let's say that somebody loses a single tooth. Their first molar, the 6-year molar is lost, gets pulled out. The first question is, a lot of people would probably say, well, it's in the back. Why do I need to even bother to replace it for? So why is it important to replace a missing tooth?
Teeth are like bricks in a building. You pull a brick out in the middle, the other teeth start to sag. Mm-hmm. Replacing even a single tooth is important to maintain the integrity of the dental arch. It prevents collapsing of the bite. People eat better when they have a full complement of teeth.
So it's more than just that you look pretty. The whole thing functions as a unit.
Absolutely.
It's like if your heart lost one ventricle, you wouldn't say, I have 3 other ventricles. You'd want to have all 4 probably working for you.
It would be ideal.
Mm-hmm. And then, okay, so once somebody's sort of committed to replacing an implant, they're typically committed to replacing, say, a single tooth. There are 3 ways to replace it. I know that you could replace it with something removable, a tooth-supported bridge, or a dental implant. So maybe take me through the pros and cons of each of those 3.
Well, removable bridges are removable.
Mm-hmm.
That means after each meal you got to take them out and wash them. When you go to sleep at night, you got to take it out and soak it.
Mm-hmm. Like Grandma.
It's something that the generation before us did, and very few young people today choose that option.
Mm-hmm.
That's just nowhere near as comfortable as having a permanent tooth.
Mm-hmm.